Hi everybody, and welcome to our show. Aging independently can seem like a challenging goal, but it can be done no matter what happens to you. Even when the situation seems hopeless, there is always hope.
My body was on fire. EMTs and all that were standing over me and just telling me not to move. And I woke up probably like 2 weeks later in the hospital, and when they told me what had happened, I was pretty upset and pretty angry that they had saved my life. You know, with no arms and legs, I just figured it'd be like a burden to most people, or I just didn't know how to move on from that. So I was lost, really lost and really angry.
9 years ago, Manuel's life changed forever.
And the crane operator with the boom of the crane, hit the power line, and I was hit twice with 115,000 volts of electricity.
After 3 months in a burn unit, Manuel came to Colorado to continue rehab.
Over time, it just got better and better, and then I realized that I could still do a lot of things, could still enjoy life, just have to have different ways of doing it.
Doctors used a cadaver bone and a muscle from his own back to increase the length of his right arm by 6 inches.
And just having the arm transplant has been amazing. I used to have to drive a wheelchair with my chin, and now I can just drive my wheelchairs with my arm, and like I can reach my face and stuff. I mean, it's just like having just 6 inches more of arm has made the world a difference.
With the help of family, friends, home health care providers, and physicians, Manuel has a new outlook.
I feel really lucky.
A wife, young daughter, and another child due soon.
I would have never even known that I would be able to have my own kids or anything. I mean, I enjoy it though. I mean, it's definitely a blessing every day to wake up to my daughter.
And he's exploring new ways to live.
I just say just don't give up. I mean, there's still a lot of things that you can do. I mean, you can still do pretty much anything you want to do. I mean, you just have to find different ways of doing things and just not give up.
Dr. Howard Ballon from Amputee Services of America joins us today. Thank you for being here.
You're welcome.
I've known Manuel for a number of years. He is an inspiration to me, and I know that a lot of people go through hopelessness. Amputees, people that have lost spouses, you name it. Let's talk about those stages of grief.
Manuel experienced all the different stages of grief, and fortunately he was able to eventually heal emotionally and physically through them. But typically we experience shock initially and dismay. That often leads to feeling anxious about your future. Depression often happens as well, and anger, because how did this happen? Why did this happen to me? Mm-hmm. And often people get stuck in one of those stages or all those stages. I think though naturally as we go through the process of time, we heal and we get better and we move on. Just like Manuel, you're right, he's such an inspiration.
So it's a combination of getting psychological counseling and also looking into physical or medical technology that can help us to improve our quality, right?
Exactly. Having a team of caregivers and friends and family really helps a lot, to have that support that we can count on, receive encouragement. I think that makes a whole bit of difference.
If we have viewers out there that would like to talk to you about your amputee services, where can they go?
Amputee Services of America, you can call 303-286-8692.
Okay, and they can call anytime, and you're able to offer a number of resources.
We have an excellent team of doctors, physical therapists, occupational therapists.
Okay, doctor, thank you so much for being here.
You're welcome.